Lumbar drain insertion on a model performed by Michael Horowitz. This is the lumbar drain package with all of the components. Here are the components for the lumbar drain insertion. Here is the lumbar catheter needle. Here's the wire that goes into the lumbar catheter. Here we are inserting the wire into the lumbar catheter. A lumbar drain can also be inserted without this wire within the tubing, but having the wire within the tubing makes passage much easier, especially in people with spine disease. Here's the catheter with the soft wire inserted. Here's the back, marked head and tail, and the midline with dotted lines. The crosshair is at the L4-5 or L5-S1 interspace. Here is the needle that is going to be used to introduce the catheter. It has a beveled edge, and each mark represents 1 centimeter. Here's the beveled edge being shown. At the L4-5 or L5-S1 interspace, the needle will be inserted. It is gently advanced between the spinous processes until we're in the thecal sac. The bevel is turned up towards the head, and the stylet is removed. Once the stylet is removed, if we're in the thecal sac, CSF will egress from the needle. The tubing is now gently inserted through the needle into the thecal sac. At no point do we want to pull back once we start inserting, or we risk shearing the tubing off against the sharp needle tip. Once the catheter is in, we will gently advance and we will pull the needle back while holding the catheter in place. The needle will be pulled out over the catheter. At no point is the needle re-advanced or is the catheter pulled out against the needle, as this can lead to shearing of the catheter. Here I will demonstrate what should not be done. At no point should the needle be advanced along the catheter, nor should the catheter be pulled out against a stationary needle. Otherwise, we risk cutting the catheter off with the needle tip. Here, we've uncovered the spine to show the insertion site between the spinous processes in the midline. The pen is showing the angle of insertion. Once it is draped, the needle is placed at the crosshairs between the spinous processes and will be advanced. The bevel is turned sideways during insertion. It will then be rotated so that the bevel is facing towards the head. This will guide the catheter upward in the thecal sac. Here we are removing the stylet. The bevel is pointing upward towards the head in the thecal sac. The catheter will now gently be advanced through the needle and directed into the thecal sac, and will hopefully be directed rostrally towards the head. Catheter is held in place as the needle is removed. The guide wire can be seen exiting the distal end of the catheter. This guide wire will now be removed while holding the catheter in place. At times there can be some resistance to pulling it, but gentle traction allows it to come off. A cap is now inserted on the end of the lumbar drain catheter. This cap will be secured with a small suture tie. A stapler is used to secure the tubing to the patient's back so that as the patient moves, the tubing does not come free. Here is the drainage system to which the catheter will be connected. Here we are connecting the lumbar drain catheter to the catheter tubing of the drainage system and collection system. A sterile clear dressing is applied and the procedure is completed.